Hello! Welcome back to Learn New Things today. And if you're new to this channel, please don't forget to hit the bell button below, subscribe, and leave your comments. Education destroys panic and fear. You do better when you know better. This video will answer the frequent questions about COVID-19. So keep on watching until the end of this video. Now, the following are the frequent questions we heard and read in the social media. Number 1. Are hand dryers effective in killing the new coronavirus? Answer is no. Hand dryers are not effective in killing the SARS-CoV-2. To protect yourself against the new coronavirus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. Number 2. How effective are thermal scanners in detecting people infected with the new coronavirus? Answer is thermal scanners are effective in detecting people who have developed a fever. Example, have a higher than normal body temperature because of the infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Number 3. Do vaccines against pneumonia protect you against the new coronavirus? Answer is no. Vaccines against pneumonia such as pneumococcal vaccine and Haemophilus influenza type B or Hib vaccine do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against SARS-CoV-2, and WHO is supporting their efforts. Although these vaccines are not effective against SARS-CoV-2, vaccination against respiratory illnesses is highly recommended to protect your health. Number 4. Can regularly rinsing your nose with saline help prevent infection with the new coronavirus? No. There is no evidence that regularly rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that regularly rinsing nose with saline can help people recover more quickly from common cold. However, regularly rinsing the nose has not been shown to prevent respiratory infections. Number 5. Can eating garlic help prevent infection with the new coronavirus? Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Number 6. Does the new coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. Number 7. Are antibiotics effective in preventing and treating the new coronavirus? Answer is no. Antibiotics do not work against viruses, only bacteria. The new coronavirus SARS-CoV-2 is a virus, and therefore, antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the SARS-CoV-2, you may receive antibiotics because bacterial co-infection is possible. Number 8. Are there any specific medicines to prevent or treat the new coronavirus? To date, there is no specific medicine recommended to prevent or treat the new coronavirus, SARS-CoV-2. However, those infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. So if you learn new things today, please don't forget to hit subscribe button and see you in my next video.